If an individual is trying to come off an antidepressant and they're trying to determine for themselves, am I having a withdrawal effect or am I having a recurrence of my depression? So how is someone to tell the difference?
So this framing of depression as this like lifelong condition that relapses when you take away a drug is trying to compare it to asthma or something like that. The timing of symptoms matters. So if things come back in a few days, it's very likely to be withdrawal. There is a thing that confuses a lot of people though, which is delayed onset withdrawal effects. So when I first saw this in patients, they came off their antidepressants and 6 weeks later they developed brain zaps and headache and dizziness. I thought that is very strange. The second issue is the nature of the symptoms. So if you stop your antidepressant and you become dizzy and have headaches and you feel depressed, then it's very likely that it's a withdrawal syndrome. The most common withdrawal symptoms are psychological. I think maybe people find that a bit hard, but you think about coming off alcohol or benzos, you feel terrible. Yes, you can get physical symptoms, but you feel terrible. And we've seen in study after study that anxiety, low mood, suicidality are common symptoms of withdrawal, because you can see them even in people who were put on antidepressants for reasons other than mental health conditions. They're put on it for pain, for the menopause, or even in healthy volunteers. And so what I always ask patients is, when you went on the antidepressant, what did you have? And if they say, I was lethargic, I was sleeping all the time, I was really depressed. And I said, what did you have when you came off the drugs? So they say, I was anxious, I was panicked, I couldn't sleep. Those are very different symptoms.